Hey everyone, welcome to this explainer. I'm really thrilled you're here today because we're going to be diving into a pretty profound paradigm shift in how we view mental health, specifically when it comes to the role of families in the recovery process. Today is all about an introduction to emotion-focused family therapy, or EFFT for short. If you've ever felt like the traditional approach to youth mental health treatment kind of leaves families sidelined, well, you're going to find this incredibly fascinating. So, I want to kick things off with a question that might sound a little radical at first. What if parents aren't the problem, but actually the solution? For decades, there's been this kind of unspoken assumption in psychology that parents are merely bystanders, or worse, that they're part of the pathology itself. EFFT completely flips that script. It introduces the core thesis that the family unit possesses immense, untapped healing potential. All right, let's get into Section 1. Parents as a source of recovery. To really grasp this, we have to look at the stark contrast between the old way of doing things and this new paradigm. Historically, youth therapy was, well, a pretty isolating experience. The kid goes into a room with a professional, and the parents? They're basically just waiting outside, acting as passive spectators. But in the EFFT paradigm, parents are viewed as an active, incredibly powerful source of recovery. Instead of pushing parents away, this approach actively strengthens their skills and their self-confidence to help their child. Which brings us right to our core definition. Emotion-focused family therapy is a treatment model where parents and key figures are finally handed an active, central role. Treatment is no longer just about the youth trying to figure things out in a vacuum. It's about equipping the entire family to heal together. It empowers the people who love the child the absolute most to become the primary agents of change. Moving on to Section 2, the scientific foundation. Okay, so to make this work, we really need to understand why symptoms show up in the first place. The foundational premise of EFT is that problem behavior, whether we're talking about anxiety, an eating disorder, or just really severe anger outbursts, is actually a desperate attempt to regulate or avoid difficult emotions. When emotions become too overwhelming or are deeply misunderstood, they drive these psychological complaints. It's like an iceberg, right? The behavior is just the tip that we see. The emotion is the massive hidden structure underneath. Now, Adele LaFrance and her colleagues didn't just invent this out of thin air. They built EFFT by combining some of the most robust psychological frameworks we have out there. It's actually a brilliant synthesis. First, from Leslie Greenberg's emotion-focused therapy, we get the idea that emotions literally hold key information. They shouldn't be suppressed, they must be safely felt. From Bowlby and Ainsworth's attachment theory, we know parents are always a crucial source of safety, even well into adolescence. Add in systems theory, which tells us that healing happens within relationships, and experiential psychology, proving that actually doing and experiencing emotions is way better than just talking about them. It's a total powerhouse combination. That leads us perfectly into Section 3, what is emotion coaching? I absolutely love the metaphor of a coach versus a mechanic for this. Think about it. A mechanic wants to instantly fix a broken part, right? And as parents, our immediate instinct is usually to be the mechanic. We see our child in pain and we just want to fix it, correct it, or make that bad emotion go away immediately. But an emotion coach does something completely different. You stay present, you listen with curiosity rather than jumping to judgment, and you guide them step by step through the storm. You don't try to stop the storm, you just sit with them in it. And when parents consistently show up as emotion coaches, this incredible psychological shift happens. The ultimate goal here is that the youth actually learns their emotions are safe. They learn that feeling intense sadness or anger is something they can tolerate, and most importantly, that those feelings will eventually subside. By being guided through their emotions by a parent, they acquire the long-term, lifelong ability to regulate themselves. All right, Section 4, 5 core tasks for parents. Now, I want to walk through these really warmly because you should look at this as a helpful roadmap, absolutely not some impossible checklist to stress you out. Task 1 is exactly what we just talked about, being an emotional coach to help process feelings. Task 2 acknowledges that sometimes symptoms are so severe, parents just have to step in with temporary practical support, like making sure a kid with an eating disorder is nourished or providing basic daily structure. Task 3 is all about promoting relationship repair, kind of healing those old misunderstandings. Task 4 is super crucial, recognizing and processing your own emotional blocks. And Task 5 is developing the deep confidence that you as the parent are making a highly meaningful contribution to your child's recovery. Next up is Section 5, blocks and relationship repair. And this brings up the elephant in the room, right? Parents often feel powerless, guilty, afraid, or deeply insecure when their child is struggling with psychological problems. If you're a parent watching this right now, I want to speak directly to you for a second. These incredibly heavy feelings, they are completely 100% normal. But EFT recognizes that these feelings, if we just leave them unaddressed, act as blocks. They can unintentionally hijack how you react to your child in moments of crisis. Because of that reality, EFFT doesn't just pat parents on the back and say, do better. It actively helps heal the healer. Using experiential techniques, things like guided imagination exercises or chair techniques from humanistic psychology, parents are given the actual space to process their own grief, fear, and frustration. By clearing out these emotional blocks, parents become truly emotionally available for their child again. Part of that processing is reframing the past. When families look back at painful histories, there is a massive difference between taking responsibility and carrying blame. EFFT helps parents take responsibility for past situations, maybe times where they just couldn't provide the support their child needed, but it does so completely without blame or guilt. The focus is entirely on acknowledging the past so we can strengthen emotional safety today, no finger-pointing allowed. Let's look at the impact in Section 6, Results and Sustainable Change. The research findings here are honestly genuinely inspiring. When parents are actively supported through FFT, they report feeling significantly more competent and way less powerless. I mean, their confidence just skyrockets. And the best part? We see highly positive clinical outcomes for the youth, particularly in really complex conditions that involved emotion dysregulation, things like eating disorders, severe anxiety, and depression. When you support the family, the child gets better faster. So, if you take nothing else away from this explainer, remember this difference between EFFT and more traditional therapies. Sustainable, lasting change doesn't happen just through surface-level behavioral tweaks or, memorizing basic communication scripts. True healing occurs when deep emotions are recognized, thoroughly processed, and safely carried within the secure bonds of family relationships. Which leaves us with this final, powerful question to reflect on today. Are we ready to truly harness the power of the family? It completely challenges us to stop viewing parents as spectators and start empowering them as the incredible, resilient healers they're capable of being. Thank you so much for hanging out with me for this explainer on emotion-focused family therapy. Keep learning, keep asking questions, and I'll catch you next time.